And welcome to the Dr. Bob Show. Are you tired all the time? You wake up in the morning and feel sleepier than when you went to bed? Or you just don't have enough energy? Are you worried about that? Could it be an illness? Could it be you just don't get to bed in time? Could it be a medical problem? Could it be a psychological problem? Could it be a sleep problem? We'll be spending most of this show talking about why am I tired all the time? My guest is Dr. Dan Ely. Dr. Ely is a board-certified internal medicine specialist, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about lowering your cholesterol with those statin drugs. Can they be dangerous? And if they are, what do we need to look out for? And those floaters in your eyes, are they simply a nuisance? Or could they be a sign that blindness could be in your future? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Dan Ely, Associate Professor at the University of Tennessee Medical Center, and we're going to be talking about, why am I so tired all the time? Dan, welcome to the Dr. Bob Show.
Thanks, Bob. Great to be here.
You're an internal medicine specialist. You see people with all types of illnesses. How often is fatigue and being too tired part of the history?
Very, very common, as you know. I would say it's the most common complaint that people have when they come to my office, and probably that of most primary care physicians.
When somebody comes in and they say, I'm just tired all the time, I just don't feel good, I don't have any energy, how do you approach what begins to go through your mind as you're looking across, let's say the person is 50 years of age and looks reasonably healthy? What do you think of?
Well, frankly, a lot of things. Fatigue is part of many disease processes, and it's part of kind of our natural, aging process. As you age, you don't have the same kind of energy you had when you were young. So I'm looking at, is this something that's really somewhat normal for this person, or is it something that's really abnormal?
And you have to go into the history and talk to the patient to see if you can find out something like that. When you talk with the patient, what do you think of when you think of lifestyle changes? You know, people do things that make them sleepy?
Exactly. Lifestyle is clearly a big factor in fatigue, and we tend to work long hours, not sleep well or not sleep enough, and simply not take enough time to do the things that will help us to have the kind of energy we like. It's easy to get into a rut.
Yeah, and that rut is, I've got to work a little bit later and I've got to get up a little bit earlier to do the things I need to do for my family, for the work, for et cetera, et cetera.
Sure.
Most of the sleep literature says now about 7.5 hours of sleep. Do you find most of your patients get that amount?
I think it varies quite a bit, but I think a substantial number don't get that amount. I think they just routinely get less, whether it's a little bit less or sometimes even a lot less.
If we're talking about lifestyle changes, how about laughter? We talk about, you got to have laughter in your life, the Dr. Bob Show. Do you think recharging the funness of life has something to do with energy?
I do, for sure. I think psychologically that has a lot of merit in helping people simply to feel better, have a fuller enjoyment of life.
It's nice to see people that laugh easy and laugh a lot and joke about things. They just seem to be more energetic with what they're doing. Naps in the afternoon?
Well, I'll tell you, I've never been a napper myself, but I have become a fan of naps for certain individuals as long as it doesn't interfere with their sleep at night. A quick nap, 20, 30 minutes in the afternoon to give you that recharge for the afternoon, I think could be a very good thing.
I've always thought that helped people with chronic illnesses. Somebody that has a type of chronic illness, you take 1 hour during the day, 11 to 12, 12 to 1, somewhere in there, and you get a 20-minute nap during that period of time. I think it refreshes the body. Let's talk about medical problems that can cause fatigue. What do you think of first in line?
Well, they're myriad, and you think of things like anemia, low blood count, which is a very common thing and a common cause of fatigue. Thyroid disorders, chronic illness such as kidney dysfunction, chronic liver dysfunction, heart disease, lung disease, all those things can factor into fatigue.
So that chronic illness causes people just not to feel good. Let's talk about anemia. What do you mean by that word?
Anemia is simply a low blood count. We're looking at the red blood cells, the RBCs, and there's a normal amount. These carry oxygen, and they're very necessary for energy and for our general sense of vitality. And if they get low, the oxygen carrying capacity is low, and you just won't feel as well.
So when you see a patient, you get their RBCs, the red blood cell count, hemoglobin, hematocrit. If it's low, how do you figure out why they're anemic?
Well, good question, and there's lots of causes, and generally it comes down to either they are losing blood or they're not making enough blood. Those are the two basic categories.
And can you tell by looking at blood work which one most likely is the cause?
Sure, we check iron levels and we check levels of things like vitamin B12, which can be a cause of low blood counts. And then we look at the size and the shape of the blood cells to see if they're being chewed up, for example, or if they're having trouble being manufactured in the bone marrow, which is where they're made.
So it's really a pretty organized evaluation, and very important is to getting that red blood cell count. How about the white blood cell count? Will that tell you if somebody's got something going wrong?
It certainly can. I don't think it's as commonly a cause of fatigue, but it will tell you if there maybe is a chronic issue that is related to blood cell production.
Let's talk about thyroid. What kind of thyroid problems make people tired?
Well, the thyroid is a gland which is primarily responsible for metabolic function, and if it produces too much thyroid, tiredness is a common manifestation. If it produces too little thyroid hormone, tiredness is a very common manifestation.
So thyroid needs to be right in a perfect sort of level. If it's too low, then why do you get tired?
Why do you get tired? Simply because you don't have the oomph that thyroid hormone helps muscle cells and brain cells and nerve cells to function at their most effective and efficient.
So if you've got too much oomph, if your thyroid hormone is too high, how does that make people tired?
Well, you may initially actually, if you got a little bit too much, you may actually feel good, like you've got a little more energy, and that feels nice. But a little too much more than that, and that'll make you tired because those same cells, again, don't work effectively.
Thyroid disease more common in men or women, and how do you make the diagnosis?
Okay, it is clearly more common in women for the most part. And there are different types of thyroid disease, but the diagnosis is pretty easily made. The testing that we have is very sensitive. A test called the TSH, thyroid stimulating hormone, is a very sensitive test for overall thyroid function.
So if the TSH is abnormal, it helps you know if fatigue is due to abnormal thyroid problem. So we've got red blood cells for anemia. We've got thyroid TSH hormone. What other major medical cause did you say could cause? How about sleep problems?
Okay, well, I mentioned kidney function and liver function, and those things are easily tested with a chemistry test. So that's part of a blood panel that the anemia and the thyroid function would be part of.
When you've got kidney and liver, are those common in our society?
Oh, absolutely, absolutely. A lot of factors, a lot of things that can cause chronic liver disease, such as hepatitis. People may not know they have it, for example. And chronic kidney disease is increasingly common. It occurs more with age. It occurs with certain medications, anti-inflammatory medicines, for example, like ibuprofen and naproxen. These are over-the-counter arthritis-type medicines. So yes, those are common conditions.
And they'll cause the kidney functions to be abnormal and cause somebody to be too tired and too pooped to pop.
Absolutely.
Are most of those easily correctable? Anemia, low red blood cells, thyroid dysfunction, and now kidney function or liver. Are those treatable things?
Absolutely treatable in almost all cases. Now, the first two, anemia and thyroid, very often we are able to normalize those things and let people have a normal lifestyle from that standpoint. Chronic kidney disease, chronic liver disease may or may not be as easily correctable, but there's definitely treatment.
Other causes of people just being too tired, other medical problems?
Well, you mentioned sleep, and
that's what we're going to be talking about when we come back. Does sleep or lack of sleep or too much sleep or improper sleep make you tired all the time? Could be the main cause. We're talking with Dr. Dan Ely, board-certified internist, Associate Professor of Internal Medicine at University of Tennessee Medical Center, and we've been talking about why am I so tired all the time. We started to mention sleep. Dan, do people sleep improperly or just not get enough sleep?
Well, I think both. A lot of times people just don't budget enough time for sleep and they get chronically sleep deprived. But clearly sleep disorders are a very common cause, or a very common thing in our society, and a very common cause of fatigue.
What are some sleep disorders? And do people know they've got them and they just don't go see the doctor for them? Name me some.
There are a whole lot of sleep disorders, but the most common ones will be obstructive sleep apnea. Most people have heard of that. Restless leg syndrome, very common. Periodic limb movement disorder is a variation of that. And those are two things that are very common. And then, of course, there's chronic insomnia. People who just don't sleep well, have a hard time falling asleep, wake up multiple times through the night.
So that's part of your history, is how well do you sleep? Do you have a hard time getting to sleep? Or if you wake up, you have a hard time going back to sleep? Do you find that a problem with people?
I absolutely do, and it's important to distinguish those things just as you mentioned. Do you fall asleep but wake up, or do you have trouble falling asleep? And within that, it's important to find out why they have trouble falling asleep. For example, do they snore, which is a very common hallmark of sleep apnea. Not that everybody who snores has sleep apnea, but snoring excessively can lead to apneic breathing, where people forget to breathe, for example, and they wake up feeling like they haven't slept well at all.
Sometimes I've heard it when somebody has obstructive sleep apnea, they have episodes where they don't breathe. It can be 15, 20 times an hour that they're waking up like that. If you did that all night, you certainly wouldn't get any sleep. How about the other person in bed? If somebody snores, is snoring keeping them from getting a good night's sleep?
Oftentimes that's the case. And the other person is a good source of information. When my patient, when I'm talking to him or her about their sleep, I often ask their spouse, well, tell me about it. Does he or she snore? Do they quit breathing at night? And do they thrash around in bed?
Thrashing around in bed, restless leg syndrome. Is there anything characteristic of that?
It's people have a hard time describing it. It's like the legs are nervous or jumpy or just won't be still. Characteristically, it doesn't bother you when you're up and about and moving around. It's when you settle down to rest that it becomes a real issue.
I've heard a patient say, well, you know, you kick the spouse and you kick the covers off and you're just restless all night long. Periodic leg movements you mentioned, what is that?
It's a similar thing to restless leg syndrome, and to make the distinction, you really have to undergo a formal sleep study and be monitored at night, which is why a sleep center is oftentimes going to be part of the evaluation of somebody with questionable sleep disorder.
I see more and more often a sleep center is a needed part of medical care to find out why somebody's not getting adequate sleep. If somebody has insomnia, they just can't get to sleep, medicines that help them, or they have to learn how to sleep, or they have to take care of a painful shoulder, or they're taking medicines that are wrong, all those things?
Absolutely, because medications are a big cause of fatigue and maybe a cause of disordered sleep. But if people chronically don't sleep well, and it doesn't seem to be sleep apnea or one of these other disorders we've talked about, then the best treatment for them may be medicines to help them rest better at night.
Since we're talking about chronic fatigue, there's a syndrome called chronic fatigue syndrome. What is that, and how do you advise people?
Sure. Chronic fatigue is a still somewhat ill-characterized syndrome that where people chronically have fatigue. We don't know exactly why. People have thought that it may have to do with viral illness and previous infections, although that's not absolutely clear. It does relate to disordered sleep, however, and people with chronic fatigue need to learn to sleep better, and they will definitely do better during the day.
Advice for those people? They sleep study, exercise, eating. What do you teach them to do?
I think good nutrition is part of it. Lifestyle measures are definitely part of it. So they need to eat well, they need to rest appropriately, but they need physical activity during the day. Discharge your physical and your mental energy during the day and you're likely to sleep better at night.
Let's talk about mental energy or mental problem. How about psychological problems causing fatigue? Do you see that playing a part?
Yeah, absolutely. You know, medical issues are common causes of fatigue, lifestyle issues are common causes of fatigue, and psychological issues. I think almost in equal parts those might be the underlying factors of fatigue, but both depression and maybe especially anxiety very commonly are associated with fatigue.
So if somebody is anxious all the time, nervous all the time, why are they tired? Where's the association?
I think it is worry doesn't allow them to adequately settle down and rest well at night. Their mind is always going and they're always worried about the next thing.
I always take pride in the fact that when I lay down, I can turn my mind off, but other people can't. They just say their mind's just going a mile a minute. Do they need medicine to help them, or they need somebody to teach them how to make their mind quiet?
Both of those are very good potential options for them. I think they also need good lifestyle measures. They need to make sure they're resting well, they are getting adequate physical activity, eating well. Counseling is a very appropriate way for people to develop their own mechanisms for helping to diffuse their worry and categorizing it, putting it in its own little box. Medicines can be helpful as well.
Getting very, very complex when we're talking about lifestyle changes and medical illnesses and now psychological problems. I'd like to mention depression a little bit more here, because how do you see depression? How do people feel with that as far as being tired?
Almost all depressed people feel like they don't have enough energy. That's just part of it. Unless they're manic, part of bipolar illness, depression by itself, that people tend to be vegetative. They tend to not want to get up and do things. They don't want to get out. They don't want to exercise. They may eat too much or not enough, sleep too much or not enough.
And they just feel blue in the morning. Life's just not worth going. That's a terrible. Is that a weakness in somebody, or is that an illness in somebody?
Well, that people need to understand that this is an illness. It is not a weakness at all. I'm glad you mentioned it that way, because it's an illness just the same as if they had diabetes, and it is treatable just the same as if they had diabetes.
I think that's such a wonderful statement, knowing that depression, anxiety, all these are treatable illnesses, and they're not a frailty of the human being. Too often people, especially in the old days, used to be embarrassed that they had depression
Sure.
or anxiety. Now it's more acceptable because there's good treatment there. Dan, thank you for coming and teaching me how not to feel tired all the time and not being too pooped to pop. It's a wonderful show, and I hope people tape it and retape it and retape it, because a lot of help for a lot of people. Thank you for coming.
Bob, I've enjoyed it very much. Thanks.
Well, I feel pretty good about being tired. Lots of things that can cause it, and lots of things that I can do for it. Now you're going to want to stay tuned, because we're going to be talking about floaters in the eye. Are they a dangerous sign or just a nuisance to somebody? And if you're trying to lower your cholesterol and you're using statin drugs, can they be dangerous? How dangerous? And what did you think about? A lot of information left. Everybody has fatigue. I was so impressed with Billy Graham, great evangelist, who one time was just very tired. He just felt tired. He just didn't have any energy. He just didn't have any get up and go. And what he started to do was to start exercising. And so he got on his sneakers and he started exercising slowly at first, and then increased the amount of time that he exercised, and suddenly he began having energy. I think there's a great message in that. One of the things that we don't do is get our body's metabolism going. And we have to do that by adequate exercise. When you exercise, there are chemicals in the brain that make us feel better. So if you don't have energy, think about exercise. It's something you can do. Also, take time for yourself. We really sometimes just don't take enough time to relax ourselves, to enjoy what we want to do. Picking up a ladies magazine, or picking up a sports magazine, or picking up an architectural magazine. Just flipping through pages, finding something that you want to do that will make your life happier, and you'll find that you start getting a little bit more energy. Get that sleep. You know, it takes sleep to fit in with all of that. We always talk about those things in the Dr. Bob Show, but it's really what I want you to do. If you're tired all the time, you just don't have enough energy, then try your exercise, try getting your sleep, eating properly. And if you're having a lot of trouble and you still don't get better, time to see your doctor. There are blood tests that he's going to do and he'll evaluate. He sees a lot of people with fatigue and just a little bit of a physical exam and proper blood work. He'll be able to guide you back to all that energy that you want. You know, try it, you'll like it. I want to thank Dr. Dan Ely. Wonderful discussion on why I'm too tired and what we can do about it. And now for questions from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob. How dangerous are the statin drugs? Well, let's talk about statin drugs. We know that people that have an elevated cholesterol have a high incidence of hardening of the arteries, of heart attacks, strokes, heart disease. So we try and lower down the cholesterol, especially the bad cholesterol, the LDL. We want that lower. We want the high cholesterol to go as high as we can. The statin drugs, after we try diet and exercise, are the medications of choice to lower the cholesterol. Now, when we look at statin drugs, what they do is they make it where the production of cholesterol is inadequate. It goes down. It blocks the production of cholesterol. And when the cholesterol gets low, we have less incidence of hardening of the arteries, strokes, and heart attacks, and actually can reverse that. But when we take statin drugs, it's like everything else. There is no free lunch. So what can statin drugs do? Well, number one, initially we think that maybe it can cause some liver problems early in the use of statin drugs. So usually your doctor will get some liver function studies when you start statin drugs. The other thing they can do is they can cause some problems in the muscles. Now, if you take a muscle cell, it has some protein in it. We call it myoglobin. And that myoglobin, if the statin drug makes the cell die, then that muscle protein gets out into the bloodstream. And if it's in large amounts, it goes down to the kidney. The kidney can't get rid of it, can't excrete it, and so it blocks up the kidneys, and we can go into acute kidney failure. So one of the things we warn people when they start statins, if you have muscle pain in the calves of your legs or down the middle of the back, think about it, talk to your doctor. He can get blood tests. He can make sure that the statin drugs are not causing problems. Now, let's continue on with statin drugs because they do a huge amount of good for people. But there were some recent studies that people that are using statin drugs may get increased incidence of type 2 diabetes. And indeed, that's the case. If people are on statin drugs, they can develop type 2 diabetes. If you get diabetes, it can cause small vessel disease. It makes the heart not function as well, the brain not function as well. We can get strokes and heart attacks just because of the diabetes, common cause of chronic kidney failure. When they take the two together, if statins cause type 2 diabetes, well, what should we do? Stop the statin? No, all the studies show that the good effects of the statin overpower the development of type 2 diabetes, which in itself can be treated with medications. Bottom line, if you're on statins, be sure that your blood sugar is checked and that it doesn't need treatment. And the treatment can be with medications or it can be losing weight and lifestyle changes. Good question. Question number two, Dr. Bob, what causes floaters? Floaters occur in the eye. They're little bitty particles, and usually they're a nuisance that we have. If we try and focus in on the floater that's there, it usually drifts away. It's because of some gelatin in the back of the eye that becomes dry, and it can actually cause refraction problems when light comes back in the eye. And it appears to be floaters. They can be in different sizes that occur. They don't cause problems unless all of a sudden you see a huge increase in the floaters. Maybe there's 30 or 40 in each eye. And there may be flashing lights that occur with that. That would be a sign of a detachment of the retina in the back of the eye, and that's an emergency. You must seek help in the emergency room, who will call the eye doctor and get started on treatment of that. Retinal detachment can be a cause of blindness. So floaters, they're fine. Sudden increase in floaters, flashing light, not fine. It's all the questions that all the time that we have with this show. Remember those 4 things we like: exercise. Can't tell you how much exercise is important on a regular basis. So just get out of bed and go out for a walk first thing in the morning, walk during lunch, after work, pick a time for exercise. Get 7.5 to 8 hours of sleep. If you're not sleeping well, think about getting a sleep study, talking to a professional about sleep. Be sure that you're eating properly. Eat good foods. We all know what good foods are. We should eat breakfast, lunch, and supper. They should be small meals. We eat too much. And we should have lots of fruits and vegetables. It's pretty simple. Eat less, exercise more. And most of all, what is it we like in the Dr. Bob Show? Have a big smile, a lot of laughter in your life. Giggle with somebody you like. Have fun. Enjoy yourself. Enjoy life. And as you laugh, you'll be healthier.